Hello everyone, my name is Shivani Mutreja. This podcast episode is going to discuss a brief overview of psychiatry and psychiatric medication history in the United States, evidence supporting overprescription, and differing influences of patients' choices regarding treatment. In 1753, the first general hospital in the U.S. was opened in Pennsylvania and the second in New York in 1791. While today we use the DSM-5 or the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, as a directory for psychiatry, in 1812 Benjamin Rush published the U.S.'s very first mental illness book of reference. It was called Medical Inquiries and Observations upon the Diseases of the Mind. In this book, Rush claimed that the causes of mental illness were due to physical imbalances or other medical causes, so he would treat them with physical remedies. These included purging, bleeding, and some inventions of his own design, such as a tranquilizing chair to dampen an overstimulated sensory system, and a centrifugal rotation chair to restore disrupted blood flow. In contrast to this perspective, according to Arts and Humanities and Psychiatry's YouTube channel, some other early civilizations attributed mood, thought, and behavioral differences to spirits, gods, and demons. Early 19th century German physician Johann Riehl invented the term psychiatry because before this time, general physicians would be the ones to treat mental illnesses, as opposed to specialized doctors, now known as psychiatrists. It used to be commonly believed that medication to solve mental problems was unrealistic or somewhat crazy talk. The first psychiatric drug to be discovered was actually by accident in the 1950s through an anesthesia booster. There was a specific YouTube video that I watched about a year ago by a YouTuber called Daniel Macker, who is an ex-New York therapist of 10 years, and says that more often than not, diagnoses of mental disorders can actually be harmful to patients. He also claimed that many of the disorders in the DSM-5 are just labels that give psychiatric workers power over patients and don't really mean that much. He then displays a long list of different disorders that are in the DSM-5, some examples being dependent personality disorder, attention deficient or hyperactivity disorder, schizoaffective disorder, adjustment disorder, borderline personality disorder, disruptive mood dysregulation disorder, agoraphobia, narcissistic personality disorder, a long list of different disorders. And he says you can stick most people in any of these categories at any given time. He also says that in psychiatry, you are supposed to push patients to take certain drugs, but it can frequently snowball into patients taking a bunch of medications, canceling out side effects from one another. This, personally for me, affirmed my apprehension towards medication. I experienced something similar a couple years ago when I was told to take birth control in order to prepare to take Accutane, but I experienced side effects from this of depression and anxiety, and so I talked to a psychiatrist about this, and I was then prescribed Zoloft, which was not really making me feel better, and I wasn't questioned if I had already been taking any sort of other medication that could have possibly caused this, and I actually was the one who figured that out for myself, that I had only started feeling this way once I was taking my birth control, and so I just stopped taking all the medication that I had been on, and then I started to feel better. And I personally think that that's something, if you're paying to see a psychiatrist, they should be able to figure that out for you, but me and a lot of other people have similar experiences of figuring this out for themselves. Daniel Macker found psychotherapy to be much more beneficial to patients than mixing psychotherapy with medication. And this perspective was very beneficial to read about because it showed a more holistic approach from someone who used to be in the field. In support of this, Dr. Joseph, a psychiatrist, says that psychiatric medication can be dangerous because they're only actually studied for 3 months before being released. There has not been enough extensive research on the potential long-term effects of using these drugs for several years. He says that there is corruption happening in psychiatry and manipulation of doctors right now in the field, such as those higher in the field working together to ensure people talking negatively about psychiatric medications are responded to from a quote-unquote non-biased standpoint, but in reality it is biased in favor of medication prescription. Dr. Tracy Marks said that patients should make decisions surrounding therapy and psychiatry depending on how severe their symptoms are and what they're looking to get out of treatment. Psychiatrists are technically therapists. They are just also able to prescribe medicine, and people who are only therapists typically can help identify negative thought patterns, change behaviors, and help patients become more self-aware.